My name is Sergio Antonio Gonzalez, and I'm going to be talking about total knee replacement, TKR or TKA, total knee arthroplasty. And it's basically a surgical procedure to reconstruct a damaged knee joint. And it's what they do is basically eliminate. They just take the part of the bone that is damaged and replace it by implant or prosthesis. It has three different areas or three different components. We have the femoral component, the tibial component, and the patellar component. The conditions associated to the surgery. The first one is osteoarthritis. And let's just move down. Next one. There you go. Is osteoarthritis, and you can see right here the damaged bone, osteophytes, and just bad condition. Rheumatoid arthritis as well, and traumatic injury, and sometimes just even wear of the joint can cause enough damage so the patient can be disabled by pain and just won't be able to move properly. And that's when the surgery would come in to basically save the day and make them able to move. It's mostly women who get the surgery because it's mostly women who get affected by osteoarthritis or rheumatoid arthritis as well. And it's usually between the age of 60 and 80 years. Around 500,000 people, this is something that I found, have the surgery a year in the United States, which is a great number, and the number is expected to go really high by 2030, like 600% up, which is a crazy thing. And in preparation for the surgery, a lot of different tests are done to the patient, including blood tests, MRIs, X-rays, CT scans, and all sort of tests just to avoid any complications, make sure the patient is in condition to get the surgery, and also to plan the surgery, to plan whatever they need to cut in the bone and take out in order to put the prostheses. Also, measurements are taken to make the prostheses to fit the patient. The rehabilitation assessment and assessment of the home should be planned ahead with the physical therapist. Antibiotics and blood thinners are used before, during, and after the surgery as well to avoid complications of infections and thromboembolisms. Anesthesia, it could be epidural or general, although epidural is recommended. Let's go ahead. These are the different tests and measurements. We can just move on. And this is the supine position. The patient has to be in supine position, 90 degrees angle for the knee in order to perform the surgery. We go down. Let's go to the next one. That's the video, I don't know, but that's the surgery per se. The implants are already there, so this is all about just dressing the knee and closing everything. The next step would be the rehabilitation process or therapy. As I said before, the damaged bone is taken out and the cartilage also removed if it's damaged, and the artificial knee is put in place. It takes about 2 hours of surgery, and the rehabilitation could start actually the next day of the surgery. Sometimes continuous passive motion is used, continuous passive motion exercise. Also different bed exercises like ankle pumps and quad sets and gluteal sets, that's on bed. But also ambulation is recommended immediately, so like the next day. So you can use braces just to protect the knee, as we can see here, and give some support. And also assistive devices like crutches or different other devices that can be used to support the patient. Range of motion exercises are progressive from passive to resistive exercises as time goes on. Also, ambulation is progressive exercises, starting with the braces, and then progressing in terms of independence, weight bearing, distance, levels, adding steps as well, and checking the gait. And strength and stretching exercises, so all the muscles can help and rehabilitate in order to get the right movement. 94% of success for the surgery, and 11 to 15 years of survival. Thank you so much.